increasing, temps getting a little bit warmer, but despite all those positive things, if you're finding yourself needing a good night's sleep, you are in luck and you're not alone. Joining us this morning is psychiatrist Dr. Kristina Kennedy with Baptist Health Behavioral Health Clinic. Good morning.
Good morning.
So we're talking about sleep. Hardly any of us are getting the sleep that we need and deserve. So what are some causes of insomnia?
There are a lot of reasons that can contribute to poor sleep. So sometimes you could have an underlying depression, anxiety. It can be pain or sleep apnea. Of course, the changes in your schedule, such as the upcoming time change. I think we all realize that every twice a year. And then sometimes there's just no cause, which is a little bit harder to deal with because a lot of the times there's nothing that you can really manage to treat that, and we have to kind of get more to the underlying issue.
Yeah, try and figure it out. So we know that, a lack of sleep causes, of course, being tired, irritability, certain health issues. But what can we do to fix the problem other than take a whole bunch of sleeping pills?
Yeah, and sleeping pills, they can work, but long term, they're really not a good option because they lose their effectiveness and they have a lot of side effects from long term use of those. Of course, if there's something that's causing you to not be able to sleep, you can try to treat that, such as if you have sleep apnea or pain or depression. But the best thing to really do is to train your body to be able to sleep better.
Okay, how do we do that?
Well, I know we've all heard of sleep hygiene, and I think people get tired of hearing about that because they say, oh, I've put my phone down and I still can't sleep. But sleep hygiene is a little bit more than that. So it's keeping all electronics off maybe an hour before bed. So I don't think we realize how many electronics are really in our life. It's the TV, it's our phone, it's everything. So trying to reduce that, limiting caffeine and alcohol throughout the day, avoiding naps, trying to stay active throughout the day, but also a little bit different than sleep hygiene, restricting your time in bed. So if you are awake, you're lying in bed, get up. It sounds counterintuitive, but you want to associate your bed with sleep. So a lot of people will say your bed should be used for sleep and sex only. And it's kind of training those different things and doing those things on a consistent basis. And truly they do work if you do all of those things and do them consistently. It's just, I know a lot of people get frustrated from doing something and not feeling like it works, but sticking with those things.
Well, there's a lot more we could talk about. We don't have the time, unfortunately, but if you want some more information on this, you can always contact Baptist Health by going to baptist-health.com or calling the Baptist Health line at 1-888-BAPTIST. Dr. Kennedy, thank you so much. And your phones are going to be ringing off the hook because people really do need some help in this area.
I talk about it every day.
Yeah, it's a problem.